Hi, and welcome to Chamber Chat. I'm Danielle McFadden, president of the Greater Lowell Chamber of Commerce. So excited to be here in the beautiful inside Lowell studios. I'm really excited for my guest today. I have 𝗖𝗵𝗺𝗶𝗖, the general manager of UniCare. We were just talking for, I don't know, 20 minutes. I said, you probably don't have your whole day to do this, but I'm just so excited to see you every time I see you.
Always a pleasure, Danielle. Psyched to be here.
Excited to have you here. So for those of you not familiar with UniCare, can you tell us a little bit about your company and it is what you do?
Sure, absolutely. So UniCare is a health benefits organization. We've been in Massachusetts for over 30 years, providing health coverage to state employees, municipal employees, and state retirees that are insured through the Group Insurance Commission. UniCare is exclusively designed, exclusively services state employees. That's what we do. State or municipal employees insured through the GIC retirees. That's what we do. It's our business. We're really proud of it, and we do it really well. So that's what UniCare is, and I'm the general manager. I am, frankly, proud to be the least of a team of people that supports, serves, and responds to state employees and our members. It is wonderful to be part of a team that's so caring and dedicated.
You have an amazing team. Everybody I've worked with is just so enthusiastic about the mission and helping people.
Yeah, thank you.
Wonderful team. UniCare is different from other health plans in Massachusetts. Let's talk about those differences because you are truly unique.
Yeah, UniCare, it's funny. Several years ago, when I was being recruited for the role, the first thing that I thought about as a former member, by the way, when I was a state government, I thought, well, first you have an indemnity plan. There are very few indemnity plans left in the United States. Well, here's one, an indemnity plan that serves state employees and retirees. Well, what's an indemnity plan? Well, essentially, you can go anywhere. An indemnity plan covers you wherever you go. And our job as an indemnity plan is to make sure that you have coverage with any provider that you frequent. That's really unique, number one. Number two, you don't need referrals to see your specialist or your provider. Our job is to support your health journey, whatever that looks like for you. Our job is to make sure that you're empowered to do that. No referrals needed? Well, let's do that too. Number three, no primary care selection. You don't need to select a primary care with us. Wow. We're not like an HMO. We're not like a PPO. We're indemnity. We will support your health journey however you want to make that look, right? Do you need chronic illness support? We have that. So that's the third feature, right? No primary care selection. And I'd say the fourth one, although some might debate this, our customer service team is remarkable. Our scores don't ever go below 95% customer satisfaction, and those are surveys from our members. It's incredible.
Incredible, especially in the healthcare field. That is huge.
Absolutely. I had a wonderful comment 2 weeks ago from the Massachusetts Retirees Association, Frank Valeri and Sean Duomo. I mentioned that our customer services are live people. We have members from our team that live in Massachusetts, et cetera, that answer the phone. And so Frank said, by the way, that's remarkable. Very few times you have customer service be live people, typically a robot and dial this number, not a UniCare. You're going to get people. And so when you have people working in the community that live next door to you, they're your neighbors supporting you, there's an accountability there. And so we take pride in that. So that's really unique for us as well. And then finally, our model of health services. We think proactively about health. Healthcare, as you know, is based on sick care. Typically, people wait for you to get sick. Well, we don't do that. We have an entire model called Whole Health that has nurses, case managers that try to engage with you proactively. And we have some other really cool tools to help you empower your health journey.
It's amazing. I understand that annual enrollment season for the GIC starts on April 5th and runs through May 3rd. So I'm sure it's a very busy time of year for you.
Really busy. Really busy.
What sort of features should individuals look for in a health plan, whether it's offered through a GIC or their employer?
That's a great question. And look, that applies to everybody. If you're an individual, well, let's break this down a bit. If you have Medicaid, right, low-income individual, might not matter as much, but some of these will. If you have Medicare, some of this will definitely matter. But if you're in the private market, if you're a private employer or if you work for a private employer, that question is really important. What should you look for in your health plan? So I would recommend at least three things, if not a few more. The first one is, do you have a family? What's your current situation, right? Do you have a family? Are you single? If you have a family, you better think about your spouse and your children. What are their needs? And then plan for that. What are they going to need? Hospital-based care, primary care, etc. So number one, do I have a family or not? Second one is, what is my medical condition and what are their medical conditions? Do we have chronic illnesses? Do we have services that we're really going to need? For example, diabetes, right? Cancer, dietary considerations, mental health, right? Those are really important questions that really lead to the next. So where do I go for services? Do I need a specific hospital? Do I need to be near Children's Hospital because I want my kids to be seen there? Do I need to be next to a community hospital? Do I want to have several specialty care physicians that I want to see? Is my primary care close by, right? So the third one is your specialist services, medical services you want nearby. And then the fourth one that I like to talk to people about is geography. Where do you live? If you live in a rural community, there are going to be very few providers in that rural community, right? Or you're going to have to travel distances to see those providers or get those services. Of course, you can access telehealth, et cetera, but when you want to be seen in person, that's a consideration. If you live in Boston, not a problem. There's dozens of providers, right? But if you live, for example, in the Blackstone Valley or Billerica or Chelmsford, you have to think about that a little bit differently. You can either go north to New Hampshire or you can travel east toward other providers or health centers. So you have to think about that as well. Geography, where do I live and what's near me? So those are some considerations. And then the final piece, some people will put this at number one. I put this toward the end as you think about all of those considerations. What am I paying for? What am I paying for? So you have your premium, you have your co-payment, your deductible, maybe co-insurance. Premium is really important. Some people don't remember the premium, but premium is what you're paying out of pocket, out of your check, month to month to buy the health insurance. If your premium is lower, understand what's inside that product. We're proud at UniCare to offer the lowest premium on the GIC shelf, right? For our community choice and UniCare Plus. Those are the lower premium products on the GIC's offerings, but Danielle, they're the most broadest coverage you can get in the GIC, right? So you're buying an incredible product at a lower premium than our competitors, but premium's important, right? And then your co-pays and deductibles. So those are some of the elements I would recommend people think about.
Yeah, it's I mean, one of the top things that we hear from businesses is health insurance, and to be competitive and to attract and retain employees, offering good health insurance is so important.
100%.
But it's also very costly for businesses.
Totally agree with you.
I think that's probably a whole other podcast we could do.
We could spend a few days talking about it.
There seems to be a shift in recent years by some health plans to take a broader view of health and focus on whole health, which I know is something that you are very passionate about. Can you talk a little bit about how UniCare focuses on whole health?
Sure, absolutely. So for context, healthcare for decades has been focused on sick care. The system was set up years ago, 1960s, et cetera, when the advent of Medicare and Medicaid, sorry. So essentially think about sick care. When people get sick, we need hospitals to treat people. Well, that's great. That worked for that time. But the reality is that the more we understand healthcare, the more we understand people, and the more times change, we have evolved toward whole health. How do we treat the whole body? For example, for decades, we ignored mental health. It just wasn't part of the healthcare experience. And so we at UniCare think about this from a whole health perspective. Your mind, your physical state, and social drivers are part of your body, your experience, and your daily living. So at UniCare, we have an entire infrastructure designed to treat and support your whole health. We have behavioral health, substance use. We have clinical nurses prepared to support you. We have case managers prepared to support you. We have dietitians. We have social workers. And we have an online platform called Sydney Health, where you can access all of your information or get in touch with our team or your physicians. You can look at your electronic medical record, your provider finders, your telehealth consults, your bills. You can talk to customer service. You can chat with them. It's a system designed to empower people in their health journey. I really believe in personal responsibility and self-agency. And so we are redesigning our model around supporting the individual to care for themselves with the support from our organization to help them do that.
I'm so glad that you brought that up because we talk about kind of whole health and even prescribing somebody a pill versus saying, have you looked at your diet? I mean, there these simple things that we can do to help our just overall health. And so I'm glad that you are looking at that and really promoting
Absolutely.
that. It's so important.
I believe in empowering people in their health journey, right? Most often, what drives the circumstances around our health are environmental factors, what we're eating,
Yeah.
our diet, our physical activity. And so we have thought carefully about that. And we're redesigning. My background was in the provider side, right? Hospital-based care, et cetera. So now at the health plan side, it's wait, time out. How do we actually empower people to think about their health and support them through that?
And I'm sure having that background is so helpful because you just carry a different lens than
Absolutely.
somebody else in that role. Why is taking this holistic approach so important to individual health?
It's a crucial question. I would say for three reasons, at least. The first one is health is crucial, right? I like to say that your greatest assets are your time and your health. Of course, family, but when it comes to your individual personality, time, and your health.
Yeah.
And so how we're able to enable you to live a healthier life, healthier lifestyle, that's crucial. So that's number one. Number two, healthcare costs. Healthcare, Massachusetts is one of the highest cost states in the nation when it comes to healthcare. Yes, we have the greatest hospitals. Yes, we have the greatest services. Yes, we create innovative solutions and pharmaceuticals. And so, yes, Massachusetts is the home for medical innovation. Absolutely. But it comes at a cost. And so the second piece is how do we think carefully and thoughtfully about lowering or mitigating the annual rise in healthcare cost? That has to be foundational as to how we redesign health services. So that's the second reason. And the third reason, frankly, very simple. It's the right thing to do. How do we help families live healthier lives and be productive people? That's good for the Commonwealth and it's good for our society in general.
That's really refreshing to hear you say that. So thank you. But yeah, it is the right thing to do. Absolutely. So UniCare is offering new program for its members with chronic conditions to be able to access care at home.
Yeah.
Please talk a little bit about that.
Absolutely. Yeah, no question. So care at home. There's a lot. Let me say this. We're in the advent of what I think is a really exciting time in healthcare. Lots of disruption in a good way. You have new providers, new companies walking into the market to say, how do we help people stay healthy outside of the hospital? How do we transition from sick care to whole health? There's a lot of new providers walking in trying to think about that. And so one of those models is care at home. So there's different things happening. There are organizations like ambulances that are trying to shift their services to intervene at the house with either paramedics or nurses in the vans, et cetera, to visit you at home and check in on you or help you stay healthy. There are hospitals that are transitioning their infrastructure to say, how do we support people at home, whether they're chronically ill, whether they're elderly. So there's some of that. There's Sydney Care I mentioned, where you try to essentially engage people in their own home or at work to say, anytime you need to have a consult or engage in your health, just open up your phone. And
That is incredible.
absolutely. Yeah. So click on your phone, tap Sydney Health, and tap into all the services we offer. That way you're proactively engaging with one of our case managers or our dietitians or our social workers to say, look, here's what I'm looking for. Can you help me? And immediately you get a response from a live person say, we got you. What do you need?
And when people are thinking about it, right? Because I mean, half the time I'll wake up in the middle of the night and say, oh, and then you forget about it or life gets busy. So to be able to do something in real time when you're thinking about it.
No question about it, right? And so as we think about how do we better support people in their health journey, that's what we're doing. So we offer a range of services. I always tell people just ask. If I don't have it, our team will certainly have it.
I love it. So can you talk about the 𝗖𝗵 healthcare program?
Awesome. Yeah, IBIS. So
And I was on the website. So interesting.
yeah, so this is another example of how
Yeah.
we help people at home. So 𝗖𝗵𝗁𝗲𝗿 is an organization that was presented to us by the Massachusetts Retiree Association. That team does a great job, by the way. Anyone who's a retiree should join that organization. They're remarkable. Their advocacy is beyond measure. So they introduced me to this company, 𝗖𝗵𝗁𝗲𝗿, and what they do is they have essentially an at-home intervention for people with chronic illnesses. And if you're a retiree, especially, or someone with chronic illnesses, they'll send you a tablet, almost like an iPad, and they essentially help monitor and support whatever chronic illness you have. So they engage with you through the tablet. They monitor your health situations. They will send someone to the house. This is the advent of a new era, as I mentioned, in healthcare, right? Where we have to think creatively about supporting people in their health journey wherever they are.
Yeah.
If you're home, we want to support you there. If you're at work and you have a situation, we should be at your beck and call. So 𝗖𝗵 is one of those companies that's really exploring that.
And I'm sure it helps with healthcare costs as well.
100%.
Yeah.
100%. Healthcare. You have to think about healthcare costs from the perspective of, if it's in a facility, it's probably going to be more expensive. If it's at home, depending on the situation.
Yep.
But that's how we like to think of it. How do we support Danielle or her family closer to home? Because of course, cost is one of those improvements and considerations, but it's better for Danielle.
And the barrier sometimes to having to go somewhere, right? Like I have 3 kids. So whether it's me or one of them, then you have to think about, do I need to have somebody watch the other 2? How long is it going to take me to get there? Do I have to go to lunch app? Like all those just little things that create a barrier for somebody who's really busy, frankly. Yeah.
Absolutely. Yeah. Our job should be to make that easier for you.
Yeah. Well, thank you for doing that.
Yeah.
In your view, what sort of role will health plans play in healthcare in the future, both near and long term?
Yeah, that's a tough question.
I'm like, I'm going to sit back for this one. This will take a while.
This is a tough one. So look, I don't have a crystal ball, but what I will say is that healthcare is evolving rapidly. There are 3 considerations for us to think about right now, real time. Of course, the first one is people. How do we better support people? That's going to mean people are probably going to start spending more time at home or away from physical activities at work, right? And so how do we think about supporting people wherever they are? That's going to mean that health plans have to pivot fast and aggressively to support people in their health journey wherever they are or whatever that looks like. So that's one. Number 2, technology and artificial intelligence. They're disrupting the industry. The more data we have, the more we understand health conditions, people's habits, behaviors. That information is continuing to help us to think differently about the services we need to offer. So 15 years ago, for example, you built up a hospital-based system or whatever. Today, that looks different. Today, that says, well, no, we don't need that. We really need somebody or something to intervene when Danielle wakes up in the morning, right? When she wants to drink her coffee or her tea, etc., and she might be having a mental health day, right? We need to be in front of Danielle for that purpose, and data is helping us to really think differently and to create new services for intervention. And then the third one I'll mention is infrastructure. What's the right infrastructure? We used to think it was brick and mortar. Well, not anymore. Not anymore. I mean, we're all of us are dealing with the sort of post-COVID environment of thinking, well, wait, do we need a big office? No.
Yeah.
We need to think differently about the infrastructure opportunity of healthcare. Healthcare should no longer, in my humble opinion, healthcare should no longer be about big brick and mortar. Healthcare should be about nimble, flexible, people-oriented infrastructure that moves along with you and your family.
That's great. Very refreshing.
Yeah.
Well, this was such an interesting conversation. I'm hoping you'll come back again because I'd love to talk about healthcare and business. And you were talking to 𝗨𝗵𝗺𝗿 so I think he's calling you too. So get ready for the podcast circuit.
Let's do it. Well, Danielle, thank you for what you do, and thank you for supporting businesses and people. You do a remarkable job, and I appreciate you.
And thank you to UniCare and you for supporting the chamber in such a big way. We really appreciate it as well.
Awesome. Thank you, Danielle.
Thank you. And thank you all for tuning into Chamber Chat. We'll be back again soon. Thanks so much.